Hello, everyone. My name is Zachary Brooks from UGenome. We make genomic medicine personal and accessible for everyone. I'm really excited today to get to talk to Miley, our medical liaison in pharmacogenomics, but really excited to hear what she says about pharmacogenomics. Great. So, can you give us an example of a person who has had an adverse drug reaction? Obviously, not any person as an individual and not named, of course, but maybe on a general level, what this person was experiencing, their condition, how they presented the adverse drug reaction, and kind of walk us through some of that story for us.
I think um, I think I have a really great story about relating straight to pharmacogenomics. So, for example, this is going to be very general because I've seen many cases. So, this is going to be a very general, not going to be specific patient. So, for example, a patient's taking statin, which is a medication to lower high cholesterol, which is also a very chronic condition, very common condition in patients in general, in any age, I would say. So, such as simvastatin, which is a statin that lower patient cholesterol. So after starting the medication, the patient experienced muscle pain, muscle weakness, unexplainable. They don't know why. They're not like moving around excessively or doing a lot of active thing or anything like that. It's kind of unexplained to have like muscle pain and weakness. And then they run through a genetic test. They share that with the healthcare providers. We recommend a genetic test. And then after the genetic testing reviews that the patient has a variant in the SLCO1B1 genes,
Wow.
which affect transport of the statins in their liver. So this genetic variation can lead to increased level of simvastatin in the blood, so raising the risk of toxicity, which is the thing that causes myelopathy and rhabdomyolysis. So by identifying this genetic predisposition, the healthcare providers can consider an alternative cholesterol lowering medication for the patient, and also
Mm.
it's kind of like finding the root cause of the problem.
Oh,
And
yeah.
maybe sometimes, if it's not too severe, we can adjust the statin dosage, or in most of the time, we will find an alternative for the patient to ensure the safety of the patient since they've already experienced the severe adverse effects, which is the rhabdomyolysis or the myopathy already. So yeah, that is an example of how pharmacogenomic can help you, can help the patient to know the adverse effects costs, and also in the future, if the patient, for example, for other patients that not experience the adverse effect yet, they already know the information, and as us know the information too, we can avoid that as a preventive approach, not as a reactive approach.
Yeah, that's super exciting. So the two things that stood out is that very specific gene you mentioned, and then how you can associate that gene in some cases with a root cause. And then we get very much what you said is to the preventative side of pharmacogenomics. You can avoid adverse drug reactions to begin with. And that's really one of the biggest goals that we have as a group, UGenome.